My name is Fan Jin, and I'm the Senior Director of the Bioanalysis at Covance China. So I'm responsible for small and large molecule bioanalysis. CBF was established in 2012, and I was on the expert committee. And also 2017, I'm also joined the steering committee and help organizing the annual conference event. So the CBS mostly will focus on promote the harmonization of the Chinese regulated bioanalysis guideline with the international guidance. And also we want to promote the execution of the regulated bioanalysis in China. So based on the principle, international standard, and also industry best practice. We also encourage the exchange between the industry and also academic in the bioanalysis field. So China CFDA just changed its name. Now it's called NMPA. It stands for the National Medical Product Administration. So since 2015, CFDA has implemented a series of reform to align the China regulation with the global standard. So certainly mandate high quality for the data quality for the clinical study. And also since then, I think there's quite a big change. And also 2017, CFDA joined ICH. You know, it's actually in the process of adapting 361 guidance from the ICH, FDA, EMA, WHO. Yeah. So as I just mentioned, CFDA just had a series of regulatory reform, so encouraging the higher standard for the drug development data in China. So I think since then, the industry, the pharmaceutical company, they're very more precautious when selecting the BioA lab in China to support their clinical study. So because of that, I think now the regulated bioanalysis is performed mostly in the GLP-GCP compliance laboratory, such as CRO, and a few there performed in the academic lab or hospital. So far, I think the standard in China is close to the international standard. And regulated bioanalysis in China is a kind of brief history. It's, I think, roughly about 12 years. So I think it still takes some years to build up more experience, especially the large molecule bioanalysis. Yeah, so we had a Chinese bioanalytical guidance in China Pharmacopoeia in 2015. So far, we still don't have the guidance for the immunogenicity. So of course, in the FDA and the EMA already have the guidance for immunogenicity. So far, we pretty much based on those international guidance for the immunogenicity testing. So certainly we want to have more collaboration with the international community, such as EBF and also AAPS. So Kelly Dong and I, we were invited to attend the EBF closed meeting on Tuesday, and we also provide an update for the CBF activity and also current China regulatory landscape. So that's just one example. And also we also want to have more, promote more harmonization between the Chinese guidance and with the international guidance. So I think at EBF I also hear the update for the ICHM-10, so that effort is ongoing. And lastly, we also want to kind of provide more development opportunity for the young scientists. Yeah, so I think, as I mentioned earlier, we're expecting more clinical study from early stage to late stage because the regulatory reform in China. So certainly we have more opportunity to supporting the drug development study. So that will help us to gain more experience in the area. And also we want to make sure have training and also develop opportunity for the young scientists in China.